Hello. Very warm welcome to all of you from the Innovation Agency. My name's Adrian Quinn. I'm a member of the digital team here at the Innovation Agency, and I'll be hosting today's Big Innovation Conversation. If you've not joined us before, our Big Innovation Conversations are monthly discussions that showcase innovations and solutions which are designed to improve health and care. Here at the Innovation Agency, we classify innovations and solutions into categories and themes which reflect the transformation and redesign challenges that we're all facing together as an increasingly integrated health and care system. We do this to support a culture of innovation that helps system transformation and adoption of those innovations. So for today's conversation on system flow, we're going to be focusing on remote support to coordinate and bring care closer to home, reducing the need for hospital admissions and attendance, and making moving between care settings safer and more efficient. We've two great speakers who will be telling us about solutions and tools which do this. First of all, we're going to be hearing from Michel Hanrahan, who's the Assistive Technology Project Manager for Wirral Health Care Commissioning. Michel's going to be telling us about Wirral Health Care Commissioning's work with Teletriage in care homes to reduce hospital admissions. We'll then be hearing from Taffy Gatawa, who is Chief Information and Compliance Officer with everyLIFE Technologies. Taffy will be telling us about everyLIFE's mobile digital care management platform and their work with care providers in Liverpool to coordinate integrated care and help people move more safely and efficiently through different care settings. But just before we start, you'll see we have a chat box available. So please just pop any questions that you have during the presentations in the chat box, and we'll aim to answer those after each speaker's finished their talk. Also, just to mention, for housekeeping, that everyone on the call today has been muted on entry to this webinar. So, just to say thank you again for all taking time out of your busy schedules to join today's discussion. And I'll now hand over to our first speaker, Michel from Wirral Health Care Commissioning.
Hi, good afternoon, everybody.
You need to share your screen, Michel, Commander. Yep, thank you.
Okay, I assume everybody can hear me and that they can see the slides that I'm about to start presenting. So as Adrian said, I'm presenting the Wirral Care Home Teletriage project. You can see our dedicated team of Teletriage nurses, along with our support system analyst. Because the system relies on iPads, and it's probably fair to say that some of our care homes aren't quite as technologically advanced as they could be. So Jeff's role has been actually vital, really, in ensuring that the whole backbone of the system operates so that all that clinical work can be done. So first of all, what is Teletriage? It just enables, using business Skype, the ability for a team of trained nurses to examine and talk to care home residents with a view really to try and keep them in their home rather than having to take them to hospital where they can end up on a trolley for many, many hours, as we all know, becoming deconditioned for reasons best known to the care homes themselves, a bit of a panic situation. It just avoids all those unnecessary attendances at A&E. We've had it in Wirral now since July 2017, since it was fully rolled out to all 78 of our care homes. So we're just coming up to 20 months, nearly 2 years anniversary, and it's really, as you'll see a little bit later on, it's starting to fit into the way that our care homes work really, really well and is valued by them. The service is available 24 hours a day. Between 8 AM and 8 PM, it's by that dedicated team of nurse practitioners. And outside of those hours, our out-of-hours GPs take over. It's provided by Wirral Community NHS Foundation Trust. And in turn, they work very, very closely with our community geriatricians, the end-of-life teams, and any other specialist teams that are required. And it's been jointly commissioned between Wirral CCG and Wirral Council, with the very welcome support from the Innovation Agency. Before I go on with the presentation, I'd just like to take you through the process really by which care homes follow when they have some concerns about a resident. So they have some basic observations equipment available to them, so they can measure O2 levels, they can measure the pulse rate, they can do blood pressure. So they complete, if they've got a concern about a resident, they complete those observations. They then call the teletriage nurse, where they speak to the nurse practitioner, or if it's out of hours, it'll be out of hours GP. There's a telephone conversation takes place to find out a little bit more about the resident and the symptoms, and obviously those observations are then communicated. And then the video-enabled elements of teletriage takes over, where the nurse or the GP, out of hours GP, can actually start to clinically assess the resident whilst viewing them, as well as taking into obviously the details that's been passed on to them. And then the nurses guide and advise the care home staff on the best course of action. Sometimes it might be to ring 999 and get the person into urgent care. It might be to say, we've had a look, nothing really to be too concerned about, but by all means, by all means observe for another couple of hours and call us back. Or it might be contact the GP, and it might require a visit from that GP or from one of the district nursing staff. So fairly straightforward. It's nice to see that this poster's up in all the care homes that I've been to. And staff, as I say, they're really warming to the whole process now, and value the ability to be able to speak to clinicians, and those clinicians be able to see the resident that they have concerns about. So back to the presentation. So what we have seen, quite dramatic drop-offs, and I can only apologise that we've only got data to the end of December. A colleague was supposed to give me the latest 3 months data to add on, but unfortunately it's not been available. But what we can see there is quite a significant drop-off, around about 70%, just under 70% drop-off in calls to 111 by care homes with regard to concerns they have about the patient. And that's really good because obviously teletriage here in Wirral is local, so they now know that they're speaking to a group of nurses who are based locally, who understand very much the nature of the particular care home that people are calling from, because they're very, very different in characteristics. So it enables the nurse to have a really good, insightful conversation with the care staff, whilst obviously also being able to speak to and see the resident who's not feeling very well. Seen about a 10% reduction in ambulance conveyances. It's difficult to determine whether these are all because of the introduction of teletriage, but certainly indicative that teletriage is offering a different route, so that 999 isn't being called, paramedics aren't arriving, and then taking people to hospital, when actually they can remain in their own homes and be treated quite appropriately there and safely. As I mentioned, the care homes, after, it was probably fair to say, a difficult start, lot of caution, lot of suspicion, but actually now more and more care homes are regularly using teletriage. Those that are using it regularly, all of them say it's really, really supportive for them. As you can see there, over 80% said it's improved staff confidence, and over 90% think that have agreed that it improves the care experience for residents. So that's from about a third of the care homes, and that survey will be going out again to gather more numbers from a greater variation of the care homes in Wirral. Just before I go on to any questions, I suppose just add a little bit of colour really into how teletriage has helped. So just a little case study really, where a patient was referred with increased confusion and reduced mobility to teletriage. The care home staff thought that this was typical of a urinary tract infection, and they just wanted to check out with the nurses. However, on observation, it actually signed that there was certainly infection However, the nurse noticed some rather laboured breathing and a productive cough. There was quite a lot of sputum was being produced. The teletriage nurse then arranged for the GP to call and visit the patient. And rather than a UTI, it was actually determined that the patient had a chest infection, which meant that the GP could immediately prescribe medication, and then the patient obviously was then observed in the care home whilst they recovered. So I suppose just in that one instance, it saved the misappropriate prescribing of medicine. I'm not a medical specialist, but I would imagine that there are probably some antibiotics that are far more effective against chest infections than they would be against a urinary tract infection. So we have lots and lots of stories. Unfortunately, I think we're probably out of time. I'd certainly like to give the opportunity for people to ask questions. So please fire away and I will answer them the very best I can. Thank you, everybody.
That's great. Thank you, Michael. That was really interesting. Really good to hear how teletriage is helping to keep people at home where they need to be rather than in hospital unless absolutely necessary. I haven't got any questions just yet on the chat box, but I've got one here. You talked about the feedback from staff in care homes. Are there any plans to get feedback from residents, or has that already been done?
To be honest, Adrian, I'm not sure. If we're not collecting that type of information, I think we certainly should be. I know I don't think I presented it here today, but I'm sure I've seen something that says or enables patients and residents to explain how they feel with this extra layer of care. I suppose that's how they would see it.
Yeah. Oh, that's great. Just got a question that's just popped up here. This is from Julie Barrett. Are the nurses advanced practitioners?
I'm not sure. I'm not sure on their qualifications. I know that they undergo specialist training to join the teletriage team. So we have 3 currently, and I think we have about 5 who are available almost like as a bank in case one of the 3 regular nurses isn't available. But whether they're advanced practitioners, I don't know. But I'm very happy to go away, get the answer to that, and then respond, if I can, through you, Adrian. Would that make sense?
Yeah, that would be great, yeah.
Okay.
We've got... have you got any idea of, or can you give us an idea of the cost of implementing all of this, you know, in terms of the hardware and the staff? Do you have any of that information to hand?
I don't have it to hand, but I know recently, I think Sarah Sheikh and I were asked just to pull together, I think, what the total investment was. I've got a figure of around about the 150,000 mark. I think there may have been additional funding because that might have just been for the capital.
Yeah. That's helpful. Thank you, Michael. Just another question here around the technological and IT user barriers. Did you experience any of those? And I suppose barriers in general, because it's not just IT, it's often cultural and it's practice-based, isn't it? So what sorts of barriers and challenges were there, and how easy or difficult were they to address?
They were quite tricky. I would suggest that anybody who wanted to follow this innovation, they really put their mind to how to win the hearts and minds of care home managers, and particularly in the preparation and the training of staff, and allowing them to become confident and competent, really, in the use of the technology. It's probably fair to say there's a very broad spectrum of care homes in Wirral, from those who are very innovative and early adopters. And if you go in, you know, it really does look like a 21st century care home. At the other end of the scale, we have some that, you know, still unfortunately, it's a little bit like walking into a care home in the 1970s, where perhaps a laptop is probably used more as a doorstop rather than as a tool to provide really great quality care. So I think anything new into those type of environments does require careful planning and really the winning over of hearts and minds of registered managers and staff. I know that in Wirral, the GPs were really, really helpful. I think just the position almost in society, I think that people see GPs as, that helped to overcome some of the resistance and some of the barriers.
That's great. And I suppose as well, there's the starting smaller with just a small group of care homes and then increasing it gradually. That possibly might have helped as well, rather than just going through all care homes in one go. Yes,
it certainly did. I think if we'd gone for a big bang for all 78, I think our team would have been on their knees. As it was, we were kept incredibly busy. But at least, you're absolutely right, Adrian, they could at least focus on the first 20 homes. And I suppose I've underestimated there, and need to just be clear again about the incredible hard work that nursing team did, because they were visiting those care homes frequently, answering questions, knocking down those barriers, dealing with the myths and all the rumours that were breaking out amongst the care home community about what Teletriage was all about. So I think they carry some well-born battle scars, but the results has been fantastic, as you can see.
Yeah. I've just got another question here from Julian Holmes. Are the care home staff trained to take vital signs measurements, and was there any resistance to this?
Yeah, I think what tends to happen is the seniors within the care homes are trained to take those basic observations. So they're trained in the use of the cuffs for blood pressure and the O2 meters and the other devices. So I don't think it's usual to find regular care staff are particularly confident and competent in using that equipment, but certainly the seniors. And I think for a care home anyway, I think if one of the more junior staff notice that one of their residents isn't very well, their immediate response and the policy within the care home is to alert a more senior member of staff anyway.
Great, thank you. I've got another question here from Jerry Fogarty. Has it reduced community delays and delayed transfers of care?
In terms from hospital back into the care home, or?
I guess both, really. So for people coming out of hospital and admission, yes. Sorry, Jerry's just qualified that.
Yeah, okay. Certainly in terms of admissions, we've seen that small or that modest reduction in conveyance to hospital. At least this way round, when someone does arrive in hospital, there's a lot more information travelling with that particular patient. So very often they can go straight through to one of the ambulatory units rather than having to go, and wait in A&E. So they come along with a little package of information that helps clinicians at the hospital determine what the best course of action is immediately. I'm not entirely certain in terms of people being released from hospital, but certainly here in Wirral, we have an integrated discharge team. The information that's gathered by the hospital, that will be passed obviously back to the care home as the resident returns. And I guess you've got teletriage there that once the patient arrives back at home, if the care home have got any additional concerns or they're not quite sure about what the hospital have released them with, so perhaps it's like a different medication or they've received some instructions about care, if they're not entirely certain, they can give the teletriage team a quick call and again get that confirmation about the best course of action.
Excuse me. Thank you, Michael. Just got one more question, then we should possibly move on to Taffy, I think. Just from Amanda Lomas. Do Wirral have neighbourhood care teams or a care home service support on a proactive model working with the response service?
Yeah, my understanding is that we have an extended GP contract. So if a care home is within a GP's practice area, there is a strong expectation that the GP takes on those patients, and also as the community nursing team and other appropriate specialist members of healthcare staff going into that home.
Great. That's really helpful. Well, if there are no other questions for Michael, then I think we will move on to Taffy. So thank you, Michael, for your presentation and for answering all of those. And now we're going to hear from Taffy from everyLIFE, who will be telling us about their mobile digital care management platform. So over to you, Taffy.
Okay, thank you. Just checking that everybody can see my screen.
Not yet, Taffy, no, we just need to share it again.
I'm not seeing the...
Yep, there you go. You can see it now.
Okay, well, thank you for asking me to come and talk about the work we did with Liverpool in implementing the PASS system. I thought it would be useful just to start with a very brief overview around how the procurement process and how the PASS system, which is a digital care management solution, as we've heard in the introduction, came to be selected as part of that project. So from the Liverpool perspective, I think they were very clear that as part of this innovative procurement, rather than go out and look to simply buy technologies, they wanted to look to procure services that would be enabled with technology, so a slightly different stance. And so they had managed to obtain some EU funding, and that was good for a number of reasons. One, it gave the authority, the local authority, the opportunity to do something different around the procurement model, but it also meant that because of the funding, all providers could be involved. And so the issue around funding, therefore, wasn't a consideration for provider in terms of being a potential restrictor to taking part in this opportunity. And so what the authority did was they invited a number of, they put out a call to come and express interest. All tech providers were welcome from across the country. So that wasn't limited to just within the Liverpool area. And tech providers were able to come and showcase their solution, and then people attending would then be able to look at the type of services that they're providing and see what technologies that were being showcased on the day might help in terms of improving the quality of those services. And it was through that process that the PASS system was selected through that showcase process. In terms of stakeholders involved in the process, so care providers, and this was looking primarily at domiciliary care providers in the first instance. We then had obviously the local authority who were doing the commissioning piece, but it was very important to make sure that we maintained the engagement with the service users and families, because this was going to be something quite different in terms of how the care was going to be delivered. We also had NHS partners in terms of other healthcare professionals who may be involved in that care, and obviously the tech providers. And it was important from the outset to start engaging with these various stakeholders and making sure that information was being shared appropriately. There was a feedback loop in terms of any questions that they might have, and any considerations both from the technology providers and the care providers need to be aware of in terms of continuing and maintaining that engagement with those various stakeholders. And so what we did was we put together a series of meetings some were designed for information sharing, some were feedback opportunities, which meant any of the stakeholders could come and provide feedback around the implementation and how that was impacting in terms of where they sat within that group of stakeholders and things that need to be considered. And we found that that worked really well in terms of maintaining that feedback channels open, and where necessary, making tweaks either because of the type of provision a care provider was giving in a particular local area or the organizational context of the particular provider. it was also useful in terms of, Michael talked earlier about some resistance or people not being sure what the implications of those, and those feedback meetings were really useful to surface any such concerns and to have an opportunity with all of the relevant stakeholders present to talk through any concerns, either around resistance or clarification questions with everybody in the room, and being really clear about what was the messaging and also consistency in that messaging going out. So some of the challenges that we encountered as we embarked on this process of implementing the care planning solution was digital maturity, varying digital maturity between different care organizations. And so, and I think that is not unusual to this particular project. But I guess what was different here was that we had a set of providers who were all coming together with a mandate to look to implement the system, and some were at different stages in terms of either trust in that system or just their attitudes around use of tech in other aspects of their business. And so trying to find a fairly consistent, uniform way of doing the implementation whilst taking account of those local variations and tailoring the engagement in a way that would best support that service to successfully implement the system. We also encountered issues around lack of resources within care providers to support that large-scale change. And again, this was related to the different sizes in the organizations. So some organizations were able to nominate a champion, and where that was possible, we found that those were the most successful implementations, both in terms of quick adoption, but also maintaining that support for people on the ground around issues that came up and providing that support and escalation of any issues either to the local authority or to us as the tech partner. Time and effort was also another consideration in terms of transfer from being on a paper-based records. Some of that was around new policies that needed to be implemented as a result of the change, or revisions to existing policies that needed to be made, as well as, I guess, a cultural piece around really understanding at organizational level what that meant in terms of going digital. And so, you know, we certainly encountered some instances where I think people thought about it in quite a concrete way of, I will have exactly the same care plan that I have on paper as an electronic record, as an example. And it was really starting that dialogue around, you know, this is an organizational change and it will touch on other aspects of how you operate within your business, and understanding that impact and where changes needed to be made. Communication between stakeholders. So I've spoken about the fora that we put together where we could share and disseminate information and gather feedback, but nevertheless, different stakeholders working in different organizations, there were still some challenges around where people were not able to attend meetings, making sure that information was disseminated to the appropriate people, any queries that might arise, and just trying to manage a group of stakeholders trying to work collaboratively across different organizational boundaries. That came with its own set of challenges. But I think those meetings helped provide a framework to try and manage that, and they were key meetings that people knew were already slated in the diary, and there would be those opportunities to raise concerns, as well as having a dedicated, certainly from the tech side, a key point of contact, which also meant that outside of those meetings that were planned, there was a nominated point of contact where if things needed to be escalated outside of those meetings, there was that mechanism to do so. And so once we got a number of the providers starting to implement and on that journey, what we found was that some of the benefits that people very quickly started to talk about, certainly at provider level, was having that ability of care notes delivered back in real time. And this was something that, as we had conversations and dialogues with other providers, came up quite frequently as a key thing, particularly around managing medication and particularly medication audits. And some of the existing processes where people were using paper, where those audits were not in real time. Often those audits would happen perhaps weeks after, once a month in some instances. And so it meant that any errors that might have been detected or any issues around medication were not detected in real time. Therefore, that opportunity to respond proactively and possibly avoid or react to an avoidable harm situation were much less. And so this was one of the immediate benefits that people reported around having those care notes delivered in time, which meant they really were able to be more responsive. Having a suite of intelligent observation forms was considered to be also very important as part of that implementation, because that was something that didn't have to be replicated in terms of transferring paper onto the system. And people talked also about the transparency between care providers, families, and service users. And that was interesting for us because there had been some resistance by some providers around, making that full care record visible, and whether that would generate more queries, or actually having to, just some anxiety around making that visible. But what we found was that certainly for the local authority, that resulted in a reduction in queries and complaints directed at the local authority, because suddenly families were able to access information remotely as well as in the home at any time. And so in situations where they might have had to call the care office, for example, because they live in a different geographical area to the person that their loved one who's receiving care, through the app, they could readily access information and see what was happening, and also have a means of communicating directly if they needed to share information. So that was one of the really positive signs in terms of the benefits. In addition to that, having a single source of record with greater security were also some of the benefits that people referenced. Providers talked about more person-centered care, being able to do that, provide more person-centered care, which was outcome-based. And this was very much around the ability for, certainly on the ground, care workers to share information readily. They could see what had gone on before, which meant they were better able to adapt their care in light of changing needs in real time. We found from the care manager's perspective, picking on the point around hospital admissions and discharges, part of the feedback we've received is around a quicker assessment for people who are deemed to be medically fit in hospital. And so because they were able to assess, they can actually do the assessment in hospital and in some cases actually implement the care package on the day. And so that was one of the benefits that people have been able to realize through implementation of the PAR system. The predictive indicators for detection risk as well, whilst people are being supported within their own homes, has meant that where perhaps service users might have declined to a point where they then need a conveyance into A&E, for example, through that predictive monitoring, again, care providers are able to be more responsive and detect that deterioration much quicker, and therefore be able to implement care interventions that mean people are not going into hospital as frequently as they might have otherwise done. From a local authority perspective, one of the things that the project did was to help support that collective management of risks between the care providers and the local authority. And this was seen to be a positive thing because it was felt that, the risks as well as the benefits were being equally shared between the local authority and the care providers. And that led also to better communication between the two parties and transparency. I've already talked about the reduction in complaints reported by the local authority. And also another thing that came out of that from the local authority perspective was that they started to see an overall improvement in CQC ratings across the provider set. And in part that was linked to more legible care notes because there were digital better audit trails, the ability to respond to issues quickly, but also the ability to evidence the quality of care that was being delivered more readily to regulators. The local authorities also have an aggregated dashboard, which means they can look to see care provider performance across their commissioning area more readily, and they can compare key metrics if necessary, and then be able to support and respond to particular areas where there appear to be issues or support just needed from the metrics that they have access to through the dashboards. And so what we learned as part of this process was really the importance of understanding the organizational culture as part of that adoption and integration piece, and really understanding that as being a key consideration from the outset, and being able to tailor that implementation and the approach to the implementation to allow for that. Because we found actually, whilst there were concerns around implementation of the technology, often it was the kind of human aspects that needed more attention and focus. And once we got under the skin of some of what those issues were within the organization, we found that the implementation was able to move more rapidly. It was also important that for us as a tech provider, we were able to give a timely response when people raised queries, so that people could continue to have faith in the implementation, but also take assurance that where they had queries and they were concerned either around safety, that we were able to respond in a timely way and really maintain that collaborative working approach. And so for us, our next steps, what we found through the feedback, we found that immensely helpful, the feedback that we got from users of the system, either in things that we hadn't considered or actually the practical application of using the system and what the issues were that were coming out. So from that, we commissioned a piece of work to do an independent evaluation of the PASS system. And so over the last year, we've had that evaluation running, and that's been completed by the Social Care Institute for Excellence. The report is now out, and we're starting to build on those findings and really understanding the benefits, but also where there are areas for improvement to help better support the sector. We're also looking to develop some machine learning algorithms, again, to support the predictive elements that I referenced. So we have that in terms of our observations that are available within the system, but we feel that we can extend this again to try and make the system as intuitive as it can be, and in supporting, particularly around that detection of deterioration for care providers. We're working with NHS Digital to develop some standards around tech in social care, but more broadly around the integration piece and interoperability. Because one of the things that we found as part of those stakeholder engagement meetings was that there was a real keenness to share information across health and care. And in particular, there was a focus in Liverpool around how we could share information coming out from the anticoagulation team and the warfarin clinic, where changes were made to medicine so that care providers knew in a timely way, and there wouldn't be gaps in people getting their warfarin medicines, etc. We learned very quickly that actually the information that people wanted to share was different depending on the stakeholder. And so GPs were interested in seeing a different data set to what care providers were interested to see. And as we explored that to really try and narrow down what were the key data that needed to flow, we then came across some IG issues from the health side. So at that time, not all care providers had NHS Mail. There were issues around sharing that information, how best to do that. There were issues around access to the warfarin clinic system, which I believe is called Dawn, for care providers. And so we weren't able to progress those conversations. But what we learned about that was, one, about clarity of what information needs to flow, but also scoping of how we might overcome those challenges. And of course, things have moved on since then, and we know that the process around care providers accessing NHS Mail is being simplified. So again, I've certainly reached out to Liverpool to look to see how we can reignite those conversations to get some of that key data around changes in medication flowing so that it makes it much more smoother a process for care providers who are going in and supporting people with their medicines at home. Finally, we're also looking to do some work around the medical integration gateway, which would enable GP information to flow into the PASS system, which again would address some of those issues around how care providers are informed of changes to medication when they happen. And so that's it from me. Thank you very much for your attention, and hopefully we still have time for some questions.
Thank you, Taffy. That was really helpful and insightful overview of some of the real-world challenges of implementing a digital technology in the regulated care sector. I haven't got any questions just yet in the chat box, I don't think. We're just having a look. Oh, yes, we do have a question. I'll read this because it's quite a long question.
Okay.
Just hold on a sec. This is from Paul Johnson. It's about the requirement for some degree of organisational change. So there was presumably a project plan around this, did you get feedback regarding how this felt for clinical staff? What did they feel like the service change was being done to rather than done with? And the requirement for them to fit their service around the technical solution, or was it more the case of that solution enabling them to deliver their service and make service improvements?
Okay.
That's quite a long.
It is quite long.
There.
Okay, let me see if I got all of it. So the first part was about project planning, is that correct?
Yes, that's right, yeah.
Okay, so typically as part of that implementation, we would have a project kickoff call where we set out sort of expectations and also go through resources and what capability there is in terms of supporting that change management process. And that's really helpful because it means early on we're flagging where there are resource issues or a provider is not able to nominate a champion, or there just isn't the change management capability within an organization. And then we look to see how we can best support that implementation. We also develop an action plan that both parties sign up to, and with clear milestones of what needs to be done by the various parties to keep the implementation progressing. And so we would do that at the beginning of a call, and where we identify risks either because of capacity within an organization, or then we would look to try and address those proactively at the beginning. So we had instances, for example, where providers decided that rather than a full-out rollout, they would do a phased rollout because of organizational circumstances. And actually that worked quite well in some organizations, because in terms of the buy-in and the being done to, people could see the impact of the change. And it gave, at local level, the opportunity to talk through the change whilst, people were gradually becoming familiar with that. So it did work well in some instances where people took that approach, and it just meant they had more time to get their team of staff more comfortable with what was happening and to surface issues in a kind of more controlled way, as it were.
Did you measure how the perception changed in terms of before, during and after the implementation?
Yes, so supporting also the piece of work was eHealth Cluster, who were based in Liverpool. And their particular remit was around that piece of getting feedback as an impartial party, I guess, to the process. And so periodically throughout, I think it was an 18-month program to get all of the providers signed on and implementing. They had key touch points where they would send a provider a feedback questionnaire and to try and understand exactly those points around, were people feeling, what was the impact, and the level of engagement, were people feeling done to, or so they did a final report, and overall it was positive. I think we had one provider who ultimately didn't implement the system, and I think there was a conversation, an agreement with the local authority around the reasons for that. But I think also now they're not providing care for Liverpool. But yeah, there were instances, and certainly not everybody was enthusiastic about the implementation. I think the fact that the funding was being provided centrally helps, because I think for some people the primary consideration would have been about the initial investment involved. But because that was something that the local authority was funding in this innovative procurement, that took that out as a consideration for some providers.
I was going to ask about that actually, because it's not just the software, it's also the hardware, isn't it? In terms of smartphones, and not all providers, their care staff have smartphones, and I wondered how that was dealt with and overcome.
Yes, so the local authority in this particular model provided that. So they provided all the smartphones and tablets if they were needed for the providers. And I think that enabled a lot more people to kind of adopt quickly, because that wasn't an immediate overhead that they had to account for. And there was a commitment from the authority to do that for the first 3 years. But I understand from our continued engagement that actually this is now being assumed as part of, shall I say, business as usual for the local authority. So that funding will run past the EU funding money, if you like.
Yeah. Just think, having to look to see whether there's any further questions. I've got a question here about, specifically for you, Taffy. It's around an overview of an event in Manchester on the 13th of May and 16th of June around bed management. Having had a look at that looks like a Greater Manchester AHSN event. So what we can do is put you in touch. Amanda, yeah, put you in touch with the Greater Manchester AHSN, who'll be able to give you a bit more information about it.
Okay.
Does anybody have any further questions for Taffy? Just checking the box. I've just got a final one, actually, Taffy. I mean, talking about everything that you went through in terms of implementing the system in Liverpool, do you have a kind of, what was the biggest learning point? What would you do differently if you were to do it again?
Early engagement of the various stakeholders, I think.
Yeah.
So I think somebody asked the question about people feeling done to in some instances, or having to reconfigure the service around a technology rather than the other way. So I think when we first started to look at what was possible in terms of sharing information from the warfarin clinic to care providers, there was certainly a feeling around that people hadn't been consulted from the outset. And so suddenly there was this drive to get information from a service that, and people within that service saying, well, why didn't we know about this? Because then we might have thought about this more proactively. And I mean, that just meant, we just had to have more dialogue around what was the problem we were trying to achieve, how that would impact that service in terms of also perhaps addressing a pain point for them, also for the care providers. And although we didn't do the work, I think we got to a better place in terms of understanding the various pain points in different organizations and actually what was the priority. Because I think initially when we put out these meetings, people would bring their wish list, as it were. Okay, well, we want this. But actually, once we got talking and understanding what were the real challenges and problems that we needed to be focusing and looking to see how the solution could better support that, a lot of those things fell away. And so it was through that. So I think early engagement, I would say, and taking time to really understand how people work and the challenges that they're facing, rather than approaching it as, well, the technology is going to solve everything, actually, because I think that isn't a model for system. Approaching it in that
I think that's a common theme between both of your experiences, both Michael and Taffy, in terms of it not just being about the technology, it's about the culture, it's about the people, it's about the way that care is provided and the people receiving that care. So if there's no other questions, I think that probably concludes our big innovation conversation for today. So just want to say a big thank you to all for joining and contributing to the conversation, and particularly to Michael and to Taffy for your time and effort in telling your stories today. So thank you, everyone, and enjoy the rest of your day.
Thank you. It's been a pleasure.